ladies and gentlemen, they just reported the first detected case of the COVID mutant, or some people call it the virus variant, in Colorado. So this just came out today, December 29th, 2020, and this is the Washington Post. First case of highly infectious coronavirus variant detected in Colorado. Colorado officials on Tuesday reported the first known case in the United States of a person infected with the mutation-laden coronavirus variant that has been circulating rapidly across much of the United Kingdom and has led to a lockdown of much of southern England. The case involves a male in his 20s who currently is in isolation in Elberg County and has no travel history, according to a tweet from the office of Governor Jared Polis, which means somebody gave it to him. He picked it up somewhere. So he can't be the only person with it. That's impossible. So I believe it's been circulating here for a while. The individual has no close contact identified so far, but public health officials are working to identify other potential cases and contacts through thorough contact tracing interviews, the tweet said. Researchers have now detected the more transmittable variant in viral samples, and they said this is in at least 17 countries outside of the United Kingdom, including as far away as Australia and South Korea as of Tuesday afternoon. Officials in Canada had previously said they identified they had identified 2, but I believe it's up to 4 cases in Canada. In almost all instances, these cases have been in people who traveled from the UK, and there's no sign so far that the variant is spreading rapidly in these other countries, including the United States. Well, they don't know that. If you detected it from a person that never traveled outside of the US, that says more people got it. Okay. While the variant appears to spread more easily, it does not make people sicker or more likely to die, scientists said in the United Kingdom, reported late Monday. Nor is there any sign that people who were infected months ago with the coronavirus are more likely to get reinfected if exposed to the variant, according to the report. And how do you know that when you have not studied this new variant yet? How do you know this? Oh, these people, man, they're so irritating. Okay. So this is according to the report from Public Health England, a government agency. Scientists also believe the mutations will not allow the virus to escape the immune response incited by vaccines, which I'm not buying. But it does appear to be more transmittable. The appearance of the variant in the United States is not a surprise. Officials have been signaling since last week that it was likely already present, but simply undetected. I'm not surprised, Anthony S. Fauci, director of the National Institute of Allergy and Infectious Diseases, said Tuesday. I think we have to keep an eye on it, and we have to take it seriously. We have previously taken any kind of mutation that might have a functional significance seriously, but I don't think we know enough about it to make any definitive statements, except to follow it carefully and study it carefully. The variant has a much higher attack rate, according to the UK report, which bolsters the hypothesis that the variant has outcompete other versions of coronavirus. and is now the dominant variant across much of the United Kingdom. Among people known to have been exposed to someone already infected, the variant is 15.1% became infected. So people exposed to someone infected with the non-variant version had a 9.8% infection rate. The difference suggests the variant is more transmittable, though the health agency said more investigation is needed to bolster the hypothesis. The working theory among many scientists is that the increased transmittability of the variant known as B117, okay, so that's what it's known as, B117, is driven by mutations that have altered the spike protein on the surface of the virus. The variant has 17 mutations. I know, I hear you already, True Royal. 17 mutations, 8 of which altered the spike protein. Precisely how those changes are leading to more infection is unknown. The virus may be binding more easily to receptor cells in the human body and replicating more easy and driving more viral loads, enhancing viral shedding by someone who was infected. Another possibility is that people are shedding virus for a longer period, upping the chances of passing it along the virus. So, primarily, evidence suggests that the new variant does not cause more severe disease or increase mortality, said Susan Hopkins, a senior medical advisor to Public Health England, in a statement released Tuesday. The newly published data echo the findings in a separate study published last week based on modeling and hospitalization data, and not yet peer reviewed, that estimated that the variant is 56% more transmittable, but doesn't appear to alter how lethal the virus is. The good news is that B117 does not seem to cause more severe disease. There is no evidence that it is managing to evade the immune system, which means vaccines are expected to protect against it, which I'm not buying. I'm not completely convinced of that. Okay. So the bad news is that B117 does appear to be much more transmittable. Okay, but with the United Kingdom seeing a severe winter surge of the infections, public officials are taking no chances and have effectively locked down southern England, including London. Other countries have banned travelers from the United Kingdom. The United States, despite having the world's highest number of documented infections, has a weak track record in publishing genomic sequences, the process that enables researchers to track changes in the virus. It figures. Most sequences have been published by academic or private research institutions. By contrast, the United Kingdom has a national health system with a robust surveillance system. So they're able to pick up on changes a lot better than the US. And that should not be the case, especially if you are the creators of medicine. That's pretty much of really a disgrace, for real. But y'all, please tell me what you think. I'm not surprised. I knew it was here, and I know damn well it can't be just one person in Colorado. That is absolutely impossible. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.